Welcome to This Week in Education Law, School Administrator's Guide, episode number 19. The case I introduced this week is about a school district's COVID-19 vaccine mandate. The issue here is whether a school district may require students to be vaccinated for COVID-19 as a condition for both attending in-person class and participating in extracurricular activities. In September 2021, the San Diego Unified School District adopted a vaccine roadmap that required students aged 16 or older to be vaccinated for COVID-19 in order to attend in-person classes and participate in sports and other extracurricular activities. Unvaccinated students were involuntarily placed on independent study. The vaccine roadmap recognized an exemption only for medical reasons, but not for religious or personal beliefs. On October 11, 2021, California Governor Gavin Newsom announced that students will be required to be vaccinated for in-person learning starting the term following FDA full approval of the vaccine for their grade span 7 to 12 and K-6. On the following day, October 12, 2021, Let Them Choose, which was a California nonprofit public benefit corporation that represented a community of more than 20,000 parents, filed a complaint and petition for a writ of mandate challenging the school district's vaccine roadmap. About 6 weeks later, a similar complaint was filed by a parent of a 16-year-old student. The two cases were consolidated for trial. On November 22, 2022, the court determined that there was a statewide standard for school vaccine, leaving no room for each of the over 1,000 individual school districts to impose a patchwork of additional vaccine mandates. The San Diego Unified School District's vaccination roadmap was in conflict with the California's Health and Safety Code. Being fully immunized is defined in the Health and Safety Code as 10 diseases for which immunizations shall be documented, plus any other disease deemed appropriate by the department after taking into consideration the recommendations of several medical groups, including the Advisory Committee on Immunization Practices of the United States Department of Health and Human Services. COVID-19 vaccine had not been added to the list of vaccinations required to attend schools in California. The FDA has not yet fully approved COVID vaccines for individuals of ages within 7 to 12 grade span. The current COVID-19 vaccines for students are approved or authorized for emergency use, and the FDA's full approval was a precondition to initiating the rulemaking process to add the COVID-19 vaccine to other vaccinations required for in-person school attendance. There is a state procedure to determine the mandatory vaccinations for school attendance. The California's Health and Safety Code states that any other disease deemed appropriate by the department, taking into consideration the recommendations of the Advisory Committee on Immunization Practices of the United States Department of Health and Human Services, the American Academy of Pediatrics, and the American Academy of Family Physicians. It means that the legislature assigned the responsibility of contemplating new vaccine mandates to the California Department of Public Health, not local school districts. The Department of Public Health is also required to consider recommendations from two national physician organizations, one specializing in pediatrics and the other in family medicine, plus the Advisory Committee, which is the key decision-making body within the federal government on childhood immunization policy. Without the FDA's full approval of the COVID vaccines for students, the state procedure of adding COVID-19 vaccine to other vaccinations required for in-person school attendance has not been initiated. The California's Health and Safety Code states that a school shall unconditionally admit or allow continued attendance to any pupil who provides documentation of each immunization required for their age or grade. Shall means mandatory. The current statute provides that students who comply with state immunization requirements are entitled to attend California schools. Because the legislature has covered the matter fully and completely, defining the who, what, when, and where of mandatory student vaccination, school districts have no remaining discretion in those matters. Since the school district is not permitted to add its own vaccination mandates, the San Diego Unified School District COVID-19 vaccination mandate unlawfully usurped the state's authority. If the school district wanted to add COVID-19 vaccine as a condition for school attendance, the school district should have urged the State Department of Public Health to follow the existing statutory procedure specified in the Health and Safety Code. Here are some updates. On April 14, 2022, the California Department of Public Health issued a statement on a new implementation timeline for adding the COVID-19 vaccine to the list of vaccinations required to attend school. California will not initiate the regulatory process for COVID vaccine requirement for the 2022 to 2023 school year, and as such, any vaccine requirements would not take effect until after full FDA approval and no sooner than July 1st, 2023. For now, COVID-19 vaccine requirements for students in California are postponed until at least the 2023 to 2024 school year. In state of Georgia Department of Public Health has not added COVID-19 vaccine to the list of vaccinations required for school attendance. I hope the case I introduced today is helpful for your daily work. I'll see you next week in This Week in Education Law School Administrator's Guide.